Now I'll quickly try to move to the next we'll move to the next syndrome. We'll be talking about a lot of syndromes, and this next syndrome here is what is known as a Freeman Sheldon syndrome. Freeman Sheldon syndrome. Okay, so you can start seeing the features. You can see the features. Okay, just take some time to observe the features there. Okay, so having observed the features, let's discuss it. So the Freeman Sheldon syndrome is also known as the Freeman Burian syndrome, or the whistling face syndrome. So your mouth is kind of like as if you are whistling. Do you understand? So that's what they call the whistling face syndrome. It's a rare congenital disorder characterized by multiple joint contractures. So your joints are just contracting, arthrogryposis, right? Arthrogryposis. All right. So there's also craniofacial abnormalities. Your face is disfigured one kind. So inheritance is usually autosomal dominant, though sporadic cases can occur. So genetic involvement is there's mutation in a gene known as the MYH3 gene. That's the embryonic myosin heavy chain gene. So pathophysiology, abnormal muscle development and contractures is what will now lead to defective muscle proteins. So clinical features: you have a small mouth with a pursed lips, a whistling face, okay, deep nasolabial folds, have a H or a V-shaped chin dimple, okay, this dimple here, okay, due to muscle contractures. Ptosis, your eyes are drooping, blepharophimosis, okay, narrowed eye openings, then low set ears. So on the musculoskeletal side, you have contractures on the fingers, contractures on the wrists, contractures on the elbows, contractures on the feet. You have club feet. You also have scoliosis and short stature. So other ones, you can have feeding difficulties in children. Okay, feeding difficulties in children. Then what again? Speech problems, hearing loss, a lot of things. Okay, lots of things. So I'm just trying to check something. Okay, and all of that. Okay, so diagnosis is clinical examination. Genetic testing will confirm that there's a mutation in this gene. The differential diagnosis is, it could be Sheldon-Hall syndrome. So management, there's no cure, but they can just try to do some 1 or 2 surgeries to correct all those bone issues. Okay, so speech therapies to physical therapies and the rest of it.